My topic is how are waterborne and vector-borne diseases spread more rapidly through flooding. The reason I chose this topic is because I've always had a general interest in how diseases spread throughout the world because of travel, all three types of natural disasters, including hydrometeorological, geophysical, and geomorphological. In this topic, in general, I have decided to study how waterborne and vector-borne diseases are transmitted and if there is an increase of transmission through hydrometeorological natural disasters. In the chart, you can see there are four main ways that diseases are transmitted. First, there are waterborne diseases, which are in the lead for disease transmission. After that, you can see vector-borne diseases, airborne diseases, and contact spread diseases. You will learn more about vector and waterborne diseases shortly, but you don't need to worry about air and contact. What are waterborne diseases? Waterborne diseases are illnesses that are spread through contaminated water. The waterborne disease is caused by a pathogenic microorganisms that have infected the water. The most common way of transmission is by drinking the contaminated water, but the disease can also be obtained by contact with the water through bathing, cleaning, etc. What are vector-borne diseases? Well, vector-borne diseases are transmitted through infected pests and vermin. All vector-borne diseases are attained through blood contact with the pest or vermin, usually through a bite or some sort of blood-sucking tactic. Let's take a step back and look at some waterborne diseases. The following are names of some different diseases. There's shigellosis, cholera, hepatitis A, leptospirosis, typhoid fever, malaria, and dengue fever. There's more information that'll come on some of those diseases, but what is some history of different waterborne diseases? Well, around 2 decades ago, Milwaukee, a city in the United States, experienced one of the largest outbreaks of waterborne disease. This outbreak affected 400,000 people, 25% of the population in Milwaukee, and cost the country, the U.S., over $96 million in healthcare-related issues. Ever since that day, the government has committed about $417 million to ensure clean water for everyone in the city. And now, the water from Milwaukee is considered to be some of the cleanest in the country. Another important moment in history took place from 1986 to 1988. 24 different U.S. states and Puerto Rico had reported several outbreaks and cases of waterborne diseases. Because of all of those outbreaks, there had been around 25,000 individual cases in that small area of the world. In 1971, CDC organized a section of their company to measure the water-related diseases. That section had a few goals, which included 1. To find the source of all waterborne disease outbreaks in the U.S., 2. To characterize these outbreaks, 3. To spread awareness about waterborne diseases, 4. To train personnel in care and treatment of different waterborne diseases, and 5. To collaborate with local governments, states, etc. on solving all issues concerning waterborne diseases. After studying the outbreaks for many years, the CDC was able to find the following. During the 3-year period, 22 of the outbreaks reported in 1986, 15 were in 1987, and 13 were in 1988, and 26% of these outbreaks occurred in January. Each of the 24 states reported at least one outbreak of waterborne disease, but Pennsylvania had 7, Colorado had 6, and Vermont had 4, which were the 3 states that had the most outbreaks. Once analyzed, the CDC was able to analyze waterborne disease outbreaks, identifying disease agents, types of water systems involved, and associated deficiencies. Now, because of this, today we are able to correctly measure water cleanliness and track the development of waterborne disease and any outbreaks that may have occurred. Now to get back to different disease specifics. First, there's cholera. Cholera is a severe diarrheal disease which can lead to death within hours if not treated. There are roughly 1.4 to 4.3 million cases every year, with a fatality rate of 28,000 to 142,000 people. The reason this disease is so hard to find is because 80% of the people do not show any symptoms except for bacteria that is present in the feces from 1 to 10 days. The second disease I will be explaining is called hepatitis A. Hepatitis A is a viral liver disease that is transmitted by both contaminated food and water. Hepatitis A can lead to very mild or severe illness, but it becomes severe when the carrier develops liver failure as a side effect. This disease rarely leads to fatality, with around only 100 deaths annually. The disease usually has an incubation period of 14 to 28 days, but the recovery from this disease can last from several weeks to several months. Some of the symptoms include loss of appetite, diarrhea, malaise, nausea, abdominal discomfort, and jaundice, which is a yellowing of the skin and whites of the eyes, as you can see here in the picture. How do waterborne diseases relate to flooding? Well, in Indonesia in 2004, there was a tsunami that killed about 167,000 people. About 82% of those deaths occurred within a week of the event from cholera and infected waters. Also, after an earthquake in Pakistan in 2005, many of people's drinking water became infected. This led to an overall increase of diarrheal disease by about 42%. It is commonly known that hurricanes occur during hurricane season, which is middle to late summer. This can become problematic since waterborne diseases thrive in heat. So if places are flooded, that means that different areas can have increased amounts of disease because of the increased amount of water. Now let's move on to vector-borne diseases. It is hard to name all of the diseases that are vector-borne since there are so many, caused by so many different types of vermin and pests, but here are a few and their descriptions. First, there is the Zika virus. This virus is caused by the female Aedes mosquito. Some of the common symptoms consist of a rash, conjunctivitis, fever, and joint pain. After the mosquito bite, the disease will typically last a few days to 1 week. It is not fatal, but if a pregnant woman is bitten and infected, the baby she is carrying may develop a birth defect known as microcephaly, which is also known as incomplete brain development. Next, there is malaria. This disease is transmitted through the female Anopheles mosquito and can be prevented and curable. 3.2 million people in the world are currently at risk of getting this disease, and most of those people are in sub-Saharan Africa. The symptoms of this disease usually show 10 to 15 days after infection. Here's a list of some of the other diseases. There's chikungunya, dengue fever, Rift Valley fever, yellow fever, Lyme disease, relapsing fever, which is also known as borreliosis, rickettsial diseases, spotted fever and Q fever, tick-borne encephalitis, and tularemia. Many countries have seen an increase of vector-borne diseases when hit by a hydrometeorological natural disaster. But why is that? Mosquitoes are waterborne creatures. Your average Anopheles female mosquito will lay her eggs in any body of water she can find, even a puddle on the ground. With more room to lay eggs, the Anopheles species thrives in flooded environments, transmitting malaria and other diseases to most of the population in that area. There are definitely ways to prevent and stop these issues, but since these diseases are caused by nature, it is hard to do. For waterborne diseases, many countries and cities have taken charge and spent lots of money to try and prevent water from being contaminated, just like Milwaukee. For vector-borne diseases, organizations like WHO have found ways to get rid of mosquitoes in an area, whether that involves giant nets or spraying systems that helps to prevent the spread of these diseases. I personally think that if we continue down the path of watching the increase of disease and where outbreaks occur, we as people can prevent, if not stop, these outbreaks in cases that are frequently seen. The only problem is that as the population increases, it will be harder to get data from every outbreak in case of waterborne diseases and vector-borne diseases. Hopefully, before the population increases too much, there will be a way to stop or prevent these diseases so they don't evolve or become too out of control.